Hi, everyone. Welcome back and good morning. Today, we are joined by Dr. Brandon Webb to give our weekly COVID-19 update to the community on what's been happening since the last time we spoke. Brandon, it's nice to see you. Thanks for joining us.
Good morning, Amanda.
Good morning. So, as always, I'm going to start with case counts and trends and kind of go over what's been happening since the last time we spoke. So, in total, in the state of Utah, we have 373,319 cases. Our deaths are at a total of 1,965, and our hospitalization ICU rate as of yesterday was 73.5% for our referral ICUs. As far as vaccines go, we have given out a total of 785,523 total. The people who have gotten one dose of the vaccine are at 507,954. And those who are fully vaccinated are at 277,717. I'm pulling up the daily case counts from yesterday really fast because I did not have that in front of me. But I do believe yesterday's case counts were below 1,000, which is great. So let's start with that, and then I'll get specifics in just one moment. But we're slowly declining, it looks like, as far as case counts and trends go. And yesterday, 6 counties were actually announced during the governor's press conference that they're moving to this moderate transmission level, including Salt Lake and Davis counties. What does this mean from a COVID risk standpoint for Utahns, and what do residents need to do to continue being safe?
Well, it's overall, it's good news. We've continued to see declines in the case counts over the last couple of months. And like other places in the country, we are starting to see some flattening of that decline, which we're paying very close attention to. And although that's been more obvious in other parts of the country, it's something that we're monitoring very closely. What we're seeing right now with the vaccine numbers that you just reported is that every week more and more Utahns are vaccinated and have at least partial and for many full immunity. And as that number continues to build, the number of individuals in our community, in our population, who are susceptible to the virus continues to decline. Right now, if you take the number of people in Utah who have received at least one dose, 507,000 individuals, and also take into account the thousands of other individuals who've not yet been vaccinated, but who had symptomatic COVID recently, it's reasonable to estimate that our current herd immunity, if you will, our population immunity, is somewhere around 30%, perhaps a little bit more, which is terrific. And with the rates of vaccination that we've seen in the last week, a single day high of 26,000 on one day this week, we're expecting to see that number continue to build. But it's not enough yet for us to fully pass the baton. But what we're seeing with these new announcements about moderate level transmission areas is an intentional approach based on case counts and the numbers of individuals in the community who are no longer susceptible to do a staged reopening. And that's the wisest course of action right now, is to do an incremental staged reopening where, as less and less people in the community are susceptible, then we're able to incrementally loosen restrictions.
And it points to all good signs. We're moving forward, which is great. And I did just find those daily case counts from yesterday, so I just wanted to say them really fast. But yesterday's was 611, which is well below that 1,000 I assumed it was. And we did have 12 people, unfortunately, pass away, though. So I just wanted to put those two pieces in there. I want to talk about vaccines. It's a very hot topic right now, and there was announcements yesterday about moving the age down to 50 starting on Monday. Is Utah on the road to recovery with the vaccines coming out? But what precautions do we also need to be taking if something does happen where there's this potential fourth surge?
Yeah, so right now, just to reemphasize, we're still in a race between vaccination and variants. And we're monitoring, like I said, those case counts really carefully, because in other parts of the country where variants have become more prevalent, we are seeing some flattening or plateau in the decline that we've enjoyed in the case counts. And if you I think it's important to remember that the virus is just a machine. It's a biological machine whose sole purpose is to survive by infecting others. And it will continue to do that as long as there are susceptible individuals in the population. It doesn't sleep. It doesn't care about politics. It doesn't care that we're all so tired of these precautions. It fully functions based on the number of susceptible individuals in our community. And so all of these incremental steps to loosen restrictions have to be linked to how many individuals in our community have immunity. And as that number builds, we'll be able to safely pass the baton from the things that we're doing to our immunity. And right now, we're not there yet. We're not at a point where we can rely on that 30% herd immunity alone. And so it is important that we continue to follow the social restrictions and precautions that have been laid out by the Department of Health and by the governor's office.
Something that I wanted to bring up around that was in that moderate transmission level, people can now sit side by side for events or movies and things like that, but they must still be wearing a mask. Can you just reiterate the importance of that? If we start to open back up, which we are, why is it so key and important to really make sure that even if you're vaccinated, you're wearing your mask all the time?
Yeah, mask wearing, as much as we're all tired of it, has been a very important tool, a layer, if you will. We've got a number of layers, which, when all implemented together, have proven to be successful at decreasing transmission. And some of those layers include avoiding poorly ventilated areas, distancing from others where possible, and wearing masks. And together, all of those decrease transmission risk. And as we continue to have less restrictions during this staged reopening, I think an important piece of advice is be wise. Be careful about your environment, know your own risk. And two, remember that when one layer is not possible, make sure that you're taking precautions with a different layer. So, for example, if you're in an area where you're not able to distance, wearing a mask is an important layer. And if you're in an area where you're not able to mask, for example, in a restaurant, then distancing is an important precaution. And I think thinking about it in terms of those layers is really important as we continue to move through these phased reopening.
Along those same lines, too, we just got a question around interaction between those who are fully vaccinated. So, if your family is fully vaccinated and maybe you haven't seen them since last year, what are the interactions like with that? Do you still recommend masks and social distancing when people are fully vaccinated?
So the reality is that we need to look at this as a community, as a population level. And as a community, we're not yet at a point where we have enough immunity to be able to give the green light to um, easing up on some of those restrictions. But on a individual basis, I think that, again, that advice to be smart about things comes into play. So if you've been vaccinated, you're healthy, your immune system works, and it's expected that the vaccine is likely to be effective, then yes, I think that making some intentional decisions about the risks that you have been being very careful about to date, and being around those you love, is absolutely appropriate. Um, but for others, I think it's important to recognize there are many in our community, and especially in this last phase, who are eligible for the vaccine because of their risk, and because of that same risk, because of chronic medical conditions or problems with their immune system. It's less likely that the vaccine will be fully effective in some individuals. And so it's a person by person decision, and not everyone should view the vaccine as a ticket to full freedom yet, while we still have fairly high community transmission.
Along those same lines too, we just had a question, and I have one for you that's similar to this, around some states completely getting rid of their mask mandates. Two of them announced that this past week. What does that mean for people here in Utah? People are not necessarily staying in their bubbles within their states. So if someone from a state comes in that doesn't have a mask mandate, could we be seeing an increase of case counts because of that? Or are there any concerns with other states moving quicker than ours?
Yeah. Well, first of all, let me just give kudos to Utahns. I think by and large, most Utahns have done a really great job following the precautions that have been in place, making personal sacrifices, and it's paid off. We've kept our hospitals from overflowing. We haven't needed to use any type of crisis standards for ICU care, and we've prevented death. And I think we can all be proud of that. But at the same time, we need to see this through to completion. There's hope on the horizon. We can see the finish line, but right now, the last thing we can afford to do is fumble the ball before we cross the goal line. And I think that as a community, if we think about it in terms of finishing strong and individuals making personal decisions based on their individual level of risk, we'll be able to get to that finish line while our vaccination distribution continues to accelerate. And I think that applies to other states as well. So individuals traveling to and from Utah, and as Utahns are able to travel, making personal decisions about their individual risk becomes increasingly important, because not everyone has the same level of risk. Not everyone's been vaccinated.
I think that's a great point too about that personal choice. You could live in a place that doesn't have a mask mandate, but you can still choose to wear one, which I know quite a few people are. So personal risk is something to really be considered and thought about. Another question for you about the two different doses. Right now, Pfizer and Moderna are two-dose vaccines. Two questions for you. The first one being, if someone happens to test positive between their first dose and their second dose, what should they be doing? Should they not get their second dose? Is there any recommendations for that piece?
Yeah, we're learning more and more about these vaccines. More than 75 million doses have now been administered in the United States, and that's a huge sample size that allows us to very quickly learn about how well they're tolerated, the safety aspects of these vaccines, and certain situations like the one you just described. What we understand now is that it certainly is possible for individuals who've had one of the two-dose series of the mRNA vaccines to unfortunately get COVID in between doses. When that happens, typically the symptoms are more mild. We're recognizing that more and more. And it is now recommended that if you do contract COVID in between your first and second dose, once your symptoms have started to resolve and you're beyond your 10-day window of isolation, it's safe and appropriate to go ahead and have that second dose.
And what is the immunity like for just the first shot of those two? Is there a certain percentage of immunity that we actually have with one versus the two?
So immunity takes time to build. And what we're now finding is that after vaccination, the longer time that your immunity has a chance to build, the more protected you are. And as researchers have gone back and looked at the clinical trial information, and as we've had, a lot of real world experience with Israel and other countries, what we're finding now is that even after that first dose, up after 21 days after that first dose, we're seeing that patients are quite protected after one dose. But that booster is still important. It still augments that immunity. And one thing we don't know yet is how that affects how long that immunity will last. And that's simply because we haven't had enough time to monitor patients who've been vaccinated and see how long their immunity lasts. So to answer that simply, yes, the longer time passes after that first dose, the more immunity and the more protection you have. But we still recommend having the full two-dose series for the mRNA vaccines. or the single dose in the case of the Johnson & Johnson.
I want to talk a little bit more about the Johnson & Johnson vaccine as well. Intermountain just started administering that, I do believe, yesterday. It's a single dose shot. It doesn't require people to come back, but there's been some concerns about the safety of the vaccine, and just because it's a different vaccine than the Pfizer and Moderna one. We'll start with, is the vaccine safe, the specific Johnson & Johnson one?
One of the advantages of the Johnson & Johnson is that the vaccine platform, the adenovirus vector platform, has been around for a longer period of time than has the mRNA platform. We have more experience. We have thousands of patients who are vaccinated with this same platform for the Ebola vaccine, and more than 200,000 individuals in other clinical trials have given us a lot of experience with that platform. And from that experience, we can say that the adenovirus vector is a safe platform. The end goal of both the adenovirus vaccine and the mRNA vaccine is the same, and that's to mimic what the virus does normally when it infects a human being, which is that it hijacks our own cells' machinery temporarily and makes its own proteins. And that's what both of these vaccine products do, and they do it very well. The data from the Johnson & Johnson clinical trials in terms of safety is very favorable. I can say that it was my privilege as part of my job to read through all 80 pages of the FDA monograph. And the safety data for the Johnson & Johnson is excellent. The symptoms that are most common are the expected symptoms: fatigue, headache, pain at the injection site, body aches, chills. Those are all signs that the vaccine is doing what we expect it to do. But serious adverse events were very uncommon. And of the serious adverse events that were reported, they were in categories of events that we know we can manage.
And what are some of the advantages to a single shot vaccine like the Johnson & Johnson one, if there are any?
Yeah, absolutely. All three of these vaccines that are now authorized are really good, and they are all very important tools in our toolbox for getting us to the end goal, which is to get that population immunity to a level where the virus isn't able to continue to cause ongoing transmission in the community. The advantages are, number one, it's a lot easier to get patients fully immunized with one shot than two. Two, it's easier to store, and logistics are much easier around the Johnson & Johnson vaccine. I think it's really important, Amanda, to point out, because there's a lot of savvy consumers that are watching these numbers, that these three vaccines really were all trialed in different populations. Different patients were in each of the trials. And so you can't really compare apples to apples when you're looking at the vaccine effectiveness. Until they've been compared head to head, it's not correct to say that one is better than the other. And the other thing I will say is that the Johnson & Johnson vaccine effectiveness data in North America was really good. 74% vaccine effectiveness early on, and more than 85% effective at preventing severe disease and hospitalization. And after 28 days after getting the vaccine, no patients in that trial required hospitalization after that. And that's terrific. That tells us that that vaccine works, that it's safe, and that, like the other two, it'll help get us across the finish line.
That's great to hear. And I think something really important to emphasize is when you go to make your appointments for a vaccine, and I'm sure you feel the same way, whatever vaccine is there is the one that you should be taking. Dr. Dunn mentioned this yesterday during the press conference, that we shouldn't really be shopping around for vaccines right now. And it really is, whatever is available to you is the one that's best for you. The only caveat is if you're 16 and 17 right now, Pfizer is the only one approved. So just make sure if you're looking for an appointment, you kind of take that into account. a question for you around kind of where we were 6 months ago to where we are now. So we've basically returned to the numbers that we had in early September before we had this fall spike. And this time we have vaccines around, whereas 6 months ago we did not. What's the outlook for the next 6 months compared to the past 6 months we just endured?
Again, I think favorable. The vaccines really are our most important tool right now. But again, for the outlook to remain favorable, two things have to happen. One, we need to we need to stay the course and get all the way through to the finish line by continuing to follow the social restrictions and the other layers of protection until our case counts and our numbers of vaccinated individuals are at a point where we can again safely pass the baton from those things that we're all tired of to immunity. And we're on track right now at the current vaccine distribution to be looking forward to being able to continue to incrementally loosen restrictions throughout the spring and into early summer. All of that's favorable. And again, the difference between this summer and this coming fall and last fall is that we expect that as the community engages in vaccination, we'll have fewer and fewer individuals who are susceptible, and the virus won't have the opportunity to spread like it did last fall.
Another question for you around hospitalizations. So as of today, 203 people are in hospitals for COVID. Someone wants to know in particular what the hospitalizations are like in areas where the transmission rate was specifically lowered, for example, like Cache County.
It's too early to say yet what the um, what the implications of lowering restrictions will be on hospitalizations. That lags behind case counts, usually by 20 days or more. So it's something that we're going to need to watch. Those areas where the transmission level has been historically low have typically translated into fewer hospitalizations. They do tend to trend together.
And I think it's important to note too that the deaths that happen too also are the same way. Everything kind of falls into line. So it'll be interesting as kind of everything starts to go down. If, like you said, we kind of see the areas that are loosening restrictions also continue to go down, which I think is super important. Another question for you. So yesterday, the governor announced moving to 50 plus starting on Monday. Have we seen a surge of people trying to schedule appointments since then? And as far as I know, those can't happen until Monday, but I'm not sure if people have actually made that decision or switch, or even if you know if there's been a surge.
Yeah, I haven't seen the dashboard that would show the numbers of hits looking for appointment slots, but anecdotally, as I interact with community members, it certainly seems like there's a lot of excitement. That represents a very large fraction of our population, and it encompasses a group of individuals who, again, by and large, have been taking more precautions than others because they're at a higher risk. And I think that there are a lot of individuals in that 50 plus group who have been looking forward to their turn to be vaccinated. And I'm excited for that as well. This is a great new development as we continue to accelerate our vaccine deployment.
Yes, I know my parents fall into that range. So I'm very happy that they're given that opportunity. So it's very exciting to kind of see things progressing. And it means that we're, like you mentioned earlier, moving at a quick speed to get those people that want the vaccine, which is great. Dr. Webb, is there anything else you'd like to mention to us today on anything that's happened in the last little bit?
Yeah, I think just going back to vaccine safety for just a minute, just wanted to reemphasize our commitment to monitoring for vaccine side effects. And again, reemphasize that many of the symptoms that people experience after vaccination are not side effects per se, they are the expected response to the vaccine. But if you are concerned that your response to the vaccine falls outside of the expected symptoms, it's important that you contact your healthcare provider and encourage them to report those vaccine related events appropriately. And the CDC has a very well-established safety reporting mechanism. And as we continue to have more and more individuals vaccinated, making sure that people who are concerned that they may have had side effects from the vaccine report that will help us to learn more about these vaccines and to deliver them safely.
Yes, that's very important. I know that after you get your vaccine, at least my experience, you can sign up for the program that will kind of ask you what your symptoms are each day. And as you get further down the road, I think it's just a weekly check-in to make sure you're still doing okay, which I think is great. Because like you've mentioned, this isn't something that's just gonna stop. We're gonna keep learning and keep getting data and make sure that we kind of are understanding it. But anything else you'd like to kind of tell us or give us a last message for our community today?
Yeah, absolutely. Again, just to reiterate, I think Utahns have done a terrific job to date. And let's see this through all the way to the finish line. Let's continue to take the precautions that have worked and continue to facilitate distribution of the vaccines. When it's your turn, we encourage you to be vaccinated, because that is our greatest tool for returning to normal, is this twofold approach of continuing the precautions that do work while we build our community immunity.
Well, thank you, Dr. Webb, so much for joining us. And if anyone watching has any questions around the COVID vaccine, they can go to intermountain.com/COVID vaccine. We have information about different resources, when you're available to actually be vaccinated, and it links you off to the state's website as well. If you're still interested in getting tested for COVID-19, you can go to intermountain.com/COVID testing. You'll be able to fill out a quick survey there and then schedule an arrival time for your appointment. We also have our emotional health relief hotline still available 7 days a week from 10 a.m. to 10 p.m. It's a free service and it's a great support tool if you need it during this time. That phone number is 833-442-2211. Thanks, Brandon. We'll talk to you later.
Thank you.